Hello everyone. Our topic of discussion today is drowning. See, drowning is a process of an asphyxia, but there is no neck compression, right? So we have respiratory impairment due to submersion, either incomplete or complete. Mostly drowning is an accidental case. It is not due to any suicidal. Okay, hanging was mostly due to suicidal. Drowning is more of accidental case. Now, first of all, let's learn the basics. See, what is surfactant? See, the lungs have this surfactant. If this surfactant was not, then let's say this is the alveoli. If there is no surfactant, then alveoli would collapse like this, right? So the surfactant increases the surface tension, so the alveoli doesn't collapse. These are the lung surfactants. Now, what is the mechanism of death in drowning? See, whenever a person falls into water, then he holds the breath, right? Because if he breathes, the water will go in, right? The person holds the breath. This creates a air hunger because the air is not going in. Now there will be involuntary inspiration. If the person is for more time inside the water, he will inspire involuntary. Now the water enters the airway. Now see, what is the difference here when water enters? Whenever in this condition there is involuntary respiration, so when water enters it is a like forceful respiration. So water enters with a lot of speed. Okay, just remember this point, that water is entering with a lot of speed that can damage the lung, right? So after the water enters there can be two paths: dry drowning and wet drowning. Let's see what these separate two things are. As I told you, whenever the water enters, it is entering with a lot of pressure. So what body does is, body knows that this water can damage the lungs. So what body will do is, it will close this vocal cord. So when this vocal cord gets closed like this, there is no entry of water. But the problem is, when the vocal cords are closed over here, there is no entry of air also. So this will lead to what? Dry drowning, or water doesn't enter but the air also doesn't enter, so there is a death. So whenever the water has, let's say, entered up till here due to forceful inspiration, water has entered up till here, but from here there will be irritation and there is a protective reflex that the vocal cords will get closed, because this water can damage the lungs. So the body will close the vocal cords. This is what reflex vocal cord spasm, and this will lead to asphyxia and death. Okay, so this was dry drowning. Now there is another mechanism from which death can occur. This is simple. Water enters here, water will enter the lungs. So we have large amount of water entry in the lungs, 4 ml per kg. Now this water enters and washes away surfactant, right? I told you what is surfactant. It was responsible for keeping the alveoli open. Now there is no surfactant, the alveoli will collapse or close. So there will be VQ mismatch. VQ means ventilation perfusion mismatch. Means there is perfusion, blood is coming, but there is no ventilation, there is no oxygen coming in, right? So now there will be cerebral anoxia, brain will not get oxygen, and there will be death. So this is wet drowning. So point here is, see, in drowning case, whenever a person goes inside the water, there is drowning, there can be two pathways of death. One is wet drowning, where water enters the lung. Other is dry drowning, person is dead but there is no water inside his lung. Why? Because there is protective vocal cord spasm, right? So this was dry drowning, atypical drowning, while wet drowning is a typical drowning. Now, another basic concept you have to learn: what is ventricular fibrillation. See, normally what happens, from this SN node, this electrical signal goes to the AV node, and from here the ventricles will contract like this. So ventricle does contraction like this, contracts, then fills it, then contracts, then fills it, then contracts, the blood gets filled. But in ventricular fibrillation there is electrical activity disruption, means the electrical currents are going in random direction, or basically what is happening is, ventricle is not contracting properly, it is quivering or fibrillating. The ventricle quivers, so there will be no proper blood flow inside the ventricles. This happens when there is excess of potassium ions, right? So excess potassium ions will cause ventricular fibrillation. Now why is this important? See, we have two types of drowning: fresh water and salt water. This is the place where water has entered the lung, right? So the fresh water and the salt water drowning is a part of wet drowning, where the water enters the lung. Now see, this is lung or alveoli, and this over here you see is the blood flow. Now in the fresh water drowning we have hypotonic water, because fresh water is hypotonic, so hypotonic water entering the alveoli. So now what is happening is, here there is less ions, so let's say X plus is the ions are less, and there is more amount of water. So more water is here, so water will flow over here in the alveoli. So we'll have hemodilution of blood in the blood vessel whenever there is hypotonic water. Whenever there is hypertonic water, hypertonic means more ions are there inside the water and there is less water, so water will flow from here to here. So in blood we will have what? Hemo concentration, right? So in salt water drowning there is hemo concentration, while in freshwater drowning there is hemodilution. Now how this will affect the death is that, see, whenever the fresh water enters hypotonic there is hemodilution, more blood inside the blood vessel. So hemodilution causes RBCs to swell. See, these are swollen RBCs. Whenever RBCs got swollen they will rupture and release K plus potassium, and I told you whenever potassium increase what happens? Hyperkalemia and ventricular fibrillation. So here death will occur by ventricular fibrillation. Plus there is also more water inside the blood vessel, so the cardiac output will increase. So amount of blood that is going to the heart will increase. The heart cannot maintain that much amount of volume, right? So there will be cardiac output and cardiac overload and cardiac failure. While in the saltwater drowning or hypertonic drowning, the water is going away from the blood vessel to the alveoli, so water is increasing in the lungs. So now there will be pulmonary edema and respiratory failure because water is going in the lungs. Second is water is going away, so RBC will be crenated or shrunken. So we'll have crenated RBC, and hemoglobin concentration will increase because the water is going, so the hemoglobin is getting concentrated. Now here also we have hypovolemia because water is the blood volume is decreasing, so we'll have hypovolemia and asystole. So mechanism of death over here is respiratory failure or pulmonary edema, or due to asystole where there is blood volume is less. Now when the blood volume is less, the iron concentration gets increased, like sodium chloride, magnesium and strontium, they all increases, right? So here we have increase in iron concentration and the respiratory failure, while here there was ventricular fibrillation or arrhythmia as potassium was increasing. Now there is a test called Gettler's test. Now what does this test do? This test compares chlorine concentration in the blood in right and the left heart chamber. See, let's say this is a heart and this is the left chambers, sorry, these are the right chambers, while these are the left chambers, and this is our lungs. Okay, so the drawing is terrible but will manage, right? So the in the Gettler test we are comparing the chloride concentration of blood in right and left heart chamber. Normally in right and left both heart chambers the chloride concentration should be equal, but when there is change, we are learning this, right? So whenever there is change, let's say chloride is more in right than left, then it is hemodilution or drowning type is fresh water. So what is happening is in fresh water we know that the blood is getting what? Blood is getting hemodiluted, so there is a hemodilution of blood. So we know from lungs which chamber receives the blood. Yes, from lungs the left chamber receives the blood, so the diluted blood will go to the left chamber. So in left chamber we have dilution, so left chamber the chlorine is decreased and right chamber has more chlorine, right? Understood? Now in salt water drowning we know there is hemo concentration. Where is hemo concentration? I told you there is hemo concentration in this blood vessel which is near the alveoli. So from lungs the water will again go to what? Left atrium. So in left atrium we have hemo concentration, so in left atrium there is concentration, so chlorine will increase in left atrium, so we'll have hemo concentration in left atrium. Left atrium has more amount of chlorine, so in salt water drowning left has more chlorine. Okay, this was the mechanism, just understand it and derive it in the exam. You can also learn it directly, like SALT, salt have LT, so left is more in salt. Done. When both are equal the patient is normal. Now this is not useful in dry drowning because no water is entering the lungs. If water doesn't enter the lungs, there is no change in concentration. And patent foramen oval, see, patent foramen oval, whenever there is a hole over here then the blood will mix. If the blood will mix in both the chamber we cannot compare the concentration in any chamber, right? So significant difference is whenever there is greater than 25% difference. Now, what is the principle of test? As you know, it compares the chlorine in both right and left heart chambers. Now, what is hydrofusion or immersion syndrome? See, whenever a person falls in cold water which is less than 5 degree below the body temperature, how this happens? Whenever this cold water strikes the eardrum, whenever the cold water goes and strike the tympanic membrane, or there is impact over epigastric region, wherever the cold water strikes over this region, or there is duck diving, or the we falling the feet is falling first in the water. In all this condition there is an anxious emotional state, so the person is in an anxious state. This will trigger vagus nerve stimulation. See, over this yellow color you see, this is the vagus nerve, and this vagus nerve will inhibit the heart activity, so there will be bradycardia, cardiac output will decrease, and there will be cardiac arrest, heart will not pump and the person will die. So the water is not entering the lungs over here also. Here the death is directly due to cardiac arrest, right? And the nerve responsible here is vagus nerve. And why this nerve is stimulated? Because of all this condition, they are leading to the anxious emotional state, right? So here also there is no involvement of any lungs. This was hydrofusion or immersion syndrome. Now, what is secondary drowning? Whenever the person is drowned and he is brought out of the water alive, but then he dies due to the consequences of drowning. So, this is secondary drowning or death after he is brought back to the land. So, person rescued from drowning but dead due to water entry in the lungs. What are the mechanisms? See, first is hypoxic ischemic encephalopathy. What is that? Till the time he was inside the water, the brain was not getting oxygen, so the brain is damaged. Person is alive, the heartbeat might be alive, but the brain is damaged, and then the person will die, right? So it is hypoxic ischemic encephalopathy. Second is electrolyte balance and metabolic acidosis. We know there is hemodilution, hemoconcentration concentration, etc. So the electrolyte balance will disturb and that will lead to death. Third is aspiration pneumonia. Let's see, the water is entering here in the alveoli. Now water is also having some impurities or bacteria. These bacteria will cause inflammation and etc, right? So the lungs is getting damaged and this is the reason of death. This is what called aspiration pneumonia. So we have water in the alveoli plus inflammation of the alveolar wall because there are bacteria also entering with that water. So this was complication of secondary drowning. How death occurs in the secondary drowning? Now flotation. See, whenever, let's say this is the river, whenever person falls in the drowning, why his body floats, why his body cannot settle down? Because inside the body there is decomposition, right? Bacteria decomposes the body and that produces gas, and this gas is what making the body come up or floating. So due to this gas the body is coming up. Now this decomposition is a bacterial process and it is faster when there is heat. So in summer this decomposition is fast, so the body will come up in one day only. But in winter it is slow, the metabolism is slow, so the body comes up after 2 to 3 days. So this was the concept about floating. Now, what are the physical findings that will tell that the person was alive at the time of drowning? Someone, in some cases the person is killed and then it is pushed over the river or led to drown. But what are the findings that tell it is an anti-mortem drowning? See, first is cadaveric spasm. When the person is alive, the person violently makes an attempt to save himself while catching the objects, right? So this is cadaveric spasm. In this attempt there is grass or mud that is clenched in his hand and the muscles are contracted that cannot be relaxed after death. So this was cadaveric spasm. This is the sign that suggests it was antemortal drowning or the struggle was going on. Second is froth in the nostril. What is froth in the nostril? See, in this image you can see this froth. Now the one thing or the one principle over here is, why is this froth made? So the one point only that you have to remember is violent respiratory struggle. The respiration is happening so violently that everything is mixing up. Let's take an example. See, whenever the person was falling in the water, what was inside his lungs? First was air, right? First he was breathing normally in the land. Whenever he falls in the water, one thing is air inside his lung. Second is, we know lungs make surfactant and mucus. So we have how much things? First is air, surfactant, mucus, and when he does the respiration forcefully inside the water, there will be also water entering in this lung. But now the violent due to violent respiratory struggle, all these things will mix, and this mixture will cause what? Froth formation. So if the person was dead, then there will not be what? Violent respiratory struggle. All these things will be there in the lung. When the person is killed and it is pushed over the river, then the water will also enter inside this lung. There will be mucus, air, surfactant, everything in his lung. But why froth will not form? Because there is no churning movement or no mixing movement. That mixing movement is caused due to violent respiratory struggle, and that is only possible if the person was alive, right? So froth in the nostril is a sign of what? Antimotor drowning, which is absent in dry drowning because water doesn't enter. I told you there has to be requirement of these four things. Second is hydrocution, and the person was unconscious, right? So this was absence of. Now how this froth is? See, this froth is fine or mucoid. Mucoid means sketchy and copious in a lot of amount and persistent. Even if you wipe this froth, it will keep coming back. So persistent, copious means large amount of, mucoid means it is a bit stretchy and it is a fine. This was about the froth in nostril or mouth. Now, these are some non-specific findings that doesn't tell the person it is antimotor drowning, but they are found in this. Now, in this diagram, you see this is the erector pili muscle. Whenever there is drowning, there is spasm of this erector pili muscle. So, these hair follicles they get erect. So, we have cutis insignia or glue's face. See over here, you can see the hair follicles are all erect. They are caused due to erectus pili muscle spasm after death. Done. So, the first non-specific finding. Second is washerwoman's hand. See what is happening in this hand. The water is going inside the layer of the skin. That is what? Imbibition of water. Water going inside the skin. This is, and this will cause this appearance of the hand. This is maceration of skin. So maceration of skin of hand, yeah, palm, due to imbibition of water. And this, the significance of this, it will tell time since emergency. How it will tell? See, let's focus just on this diagram. See, this is a normal skin, and in the normal skin we have pigments that give us the color of the skin in the outer layer. Now whenever initially water will enter, this skin will wrinkle like this. So we have first step, wrinkling. Whenever the water enters, skin will be wrinkled like this. So we have in 3 to 4 hours this wrinkling will happen. Now, due to this wrinkling, this water will go between the layers of the skin and the upper layer will detach. This is what peeling of cuticle. Water is going between the layer of the skin and the upper layer is getting detached. So this is peeling of skin and bleaching. These all pigments are getting washed away by the water. So we have peeling of cuticle and bleaching in 12 hours. Right? So first was what? Wrinkling in 3 to 4 hours, then we have peeling and washing away of pigments in 12 hours, and at last we have from in 24 hours we'll have shortening. So this washerwoman's hand, this can signify the time since immersion, how much time the body is inside the water. And the progression is, it first appears in the fingers, then palm, back of the hand, and then to the sole, and it is seen more in warm water. Now, what are the these were the external findings, appearance on skin, hair, nose, etc. What are the internal findings? See, first internal finding is there will be entry of water in the lung, so the lung will be voluminous. Now, what is crepilliant? See, as I told you, when the person was alive, not inside the water, there was air inside the lung. When he goes inside the water, then the water comes. So now we'll have water and air, some air and water both inside the lung. So now when we'll press these lungs over here, then this air bubble will burst and there will be some sound, and that sound is called crepilliant sound. So the one is lung has a lot of water, say the voluminous lung. Second is we have this crepilliant sound when this air bubble bursts. So we have two features. Third is ballooning out on opening the sternum. Obviously if the lung is expanded due to high volume, whenever we break the sternum, the lung will balloon out. And last is mud particles in the lower airway. Due to that respiratory struggle, the mud goes till over here. Right? So this was feature of a submerged lung. Now what is pote what is Polteau's hemorrhage? Sorry, my mistake. What is Polteau's hemorrhage? See, in this lung, these are the blood vessels, right? So whenever a person is doing a violent respiratory struggle, what will happen? These blood vessels will break and this blood will leak inside these lungs. So we'll see small dot of hemorrhages. So these are Polteau's hemorrhages. Whenever there is violent respiratory struggle, that will cause these capillaries to rupture and the blood will go out, and the blood going out and staying over there, that is called hemorrhage. So we have Polteau's hemorrhage. Next one is emphysematous bullae. What is emphysematous bullae? As I told you, there is both water and air inside this lung, right? So this air bubble trapped in water, that is emphysematous bullae. So we have two things, Polteau's hemorrhage and emphysematous bullae. Now both this thing combines, we give it another name. That is what? Emphysema aquosum. We are combining two names. One is Polteau's hemorrhage and emphysematous bullae. That combination is called emphysema aquosum, and it is a sign of antemotum or conscious drowning. Now, can you tell me why it is a sign of conscious drowning? Because see, here this Polteau's hemorrhage is what? Rupture of vessel, and when the vessel will rupture, when there will be violent respiratory struggle, so water will come in with a force and it will break the vessels, right? So due to that, it is a sign of conscious or antemotum drowning. Now, edema aquosum means there is heavy lungs with water, but there is no frothing. So, no frothing, then the term is edema aquosum, and it is a sign of unconscious antemotor drowning. Why? Because the person is not conscious. If not conscious, then there no violent respiratory struggle, and that is no froth. There is no mixing, so there is no froth. Now, the last one is just a vague term used for hydrostatic lungs, which is the type of in post-mortem drowning. We have just hydrostatic lung, which is just a vague term. Now, let's learn something basic about paranasal sinus. See, your skull is a entire heavy bone. If it doesn't have this air sinuses, then the weight would increase. So we have these small air cavities inside the lung, which will reduce the weight. Now, how these paranasal sinuses are relevant in this discussion over here? See, we have Sveshnikov's sign. What is Sveshnikov's sign? Water entering in this paranasal sinuses. Now, if water is in paranasal sinus, how it went there? When the person was alive, there is a violent respiratory struggle, and that leads to going of water inside this sinuses also. So Sveshnikov's sign is a sign of what? Antemotum drowning. Same goes with water inside stomach or intestine. If the person was dead, then the water cannot go past stomach to the intestine. It cannot go that deep. It can only happen if the person was alive and was violently struggling. So we have water inside the stomach or intestine is a sign of antemotum drowning. So two signs we learned: Sveshnikov's and water inside the stomach or intestine. Second one is Yunos sign. See, it's the same mechanism. Whenever there is violent respiratory struggle, the water will go via this eustachian tube to the middle ear. So water in the middle ear is called Yunos sign, and that is also a sign of antimotor drowning. Now see, middle ear hemorrhage is a non-specific sign. Why? Because if the person was alive or dead, it doesn't matter. Whenever the person will go deep inside the water, there will be pressure changes. So there will be more pressure over here in the environment. Whenever there is more pressure and less pressure inside the middle ear, then this eardrum will rupture, and that will cause hemorrhage. It is not depend on the person was alive or dead. That will cause in every body which is down inside the water. So we have a non-specific finding called middle ear hemorrhage. It is not a sign of antemotum drowning. Now, the last topic is diatom test. See, whenever there is whenever the person is drowning and he is inspirating, the water will come inside the lungs. This water will go to the alveoli to the blood flow, and from these blood vessels it will go to the heart. And from heart, water that blood is pumped in entire body. Now this water also have diatoms. So if the diatoms goes to the heart and pump towards the bone marrow, brain, spleen, that means that the person was alive and was breathing. That breathing has caused this diatom to go deep in the bone marrow, brain, and spleen, right? So this in antemotum drowning we have diatoms test. Like, what are diatoms? Diatoms are unicellular algae present in the water body. See, these are diatoms in the water body. They're coated with silica and they're resistant to heat, acid, and most importantly, they're resistant to putrefaction also. So that's why we can use this diatom to identify after even the body is decayed that it was antemortem or post-mortem drowning, right? So significantly it's a sign of antemortem drowning, and we have to compare the body water, how much diatoms are there in the water bodies outside and inside to with the specimen that we have obtained, right? So this was about diatom test. Okay, so the lecture is not over. What is typical atypical? See, this we studied earlier that if the water enters, it is typical. Water doesn't enter and laryngeal spasm, it was atypical, right? And what was the reason why water is not entering? Because the body is protecting it. Whenever the water is coming with a high force, body doesn't want the lungs to get damaged, so it will close the larynx. But the problem is if the larynx is closed, there is no entry of air also, and the person dies. So we have typical drowning in fresh water and salt water. Obviously, when water comes, it's typical. Atypical drowning is seen in dry drowning that we studied in hydrocution. Now, here the death is not due to water entry inside the lungs, right? Now, diagnosis of drowning. See, antemortem or postmortem drowning is a diagnosis of exclusion. After we have ruled out everything, every science, then we can say, okay, this is antemortem or this is a postmortem drowning.